Hello, everybody. Thank you for coming to today's workshop. I will be your moderator this morning. I'm looking forward to hearing from our speaker today on this very important topic. I'm pleased to introduce Dr. Simon Young. Dr. Young is a pharmacist, acupuncturist, and a certified herbalist with in-depth knowledge of botanical products and potential herb-drug interactions. He manages the Integrative Medicine Service at Memorial Sloan Kettering Cancer Center's About Herbs website, which provides unbiased information about dietary supplements and unproven anti-cancer treatments. He also consults with patients about the proper use of dietary supplements and participates in designing clinical trials on herbal products and acupuncture. So without further ado, please welcome and introducing Dr. Young.
Thank you. Good morning. So today I'm going to talk about integrative oncology. Many of you already went through treatment, and today's is a successful treatment can also produce many difficult physical and emotional symptoms. Now, symptom relief is sought during treatment and often throughout survivorship. Integrative medicine uses non-pharmacological or complementary adjunctive therapy to relieve symptoms. Integrative medicine does not actually treat the cancer itself. In general, integrative therapy are inexpensive, safe, they're usually effective, and we use the treatment that evidence-based. Now, I want to clarify some important terminology difference. Many people mix up complementary and alternative together because it's called complementary alternative medicine, and in fact, they're not the same. Complementary therapy or integrative therapy are rational and evidence-based, while alternative medicine used instead of mainstream medicine, and there is no real viable alternative therapy. And sometimes those are promoted alternative are typical quackery. So the way I organize this talk is that I'm going to talk about integrative medicine. When integrative medicine is used in the cancer treatment and oncology setting, we call it integrative oncology. And I'll let you know what they are and what they're not. And I'm going to introduce a few of these integrative and complementary therapies. And I want to touch on the quackery issues. And I'm going to tell you where you can get information and education on this topic. So integrative therapy can control symptoms. Here are a list of symptoms that have been shown scientifically to be effective, such as pain, hot flashes, sexual dysfunction, urinary problems, fatigue, xerostomia, this is dry mouth, anxiety, depression, stress, and lymphedema. The Memorial Sloan Kettering Cancer Centers, we started integrative medicine department since 1999, and we are created as a prototype, and many other hospitals had created a similar service since then. We provide rational and evidence-based therapy for both inpatient and outpatient. And this is a picture of our center. The type of integrative therapy we provide include massage therapy, Mindbody therapies, music therapy, acupuncture, which I'm going to talk about more, a diet, nutrition, supplements, exercise, and fitness. First one I'll talk about is massage therapy. Now, this is some research on massage therapy on cancer patients. The overall data suggests that massage therapy can have some transient benefit and usually welcoming by patients. And one of the study on 70 pediatric cancer patients, if you give them massage therapy 20 minutes, half an hour, and 24 hours before chemo, and then 24 hours after chemo, it can help to reduce chemo-induced nausea and vomiting. This is another study using massage therapy on BMT patients as well. They find out that massage therapy can reduce the psychological and neurological symptoms. The next one is this Mindbody technique. The mind-body technique is based on the notion that the mind and the body are one. And if you have a kind body, you have a calm mind, and vice versa. And technique used include meditation, self-hypnosis, the yoga, which is a form of exercise meditation from India, Qigong and Tai Chi from China. Both of these are considered exercise, but they also have a meditation component, and also other relaxation therapies. Now, many studies suggest that this mind-body therapy can help to reduce pain, anxiety, insomnia, and stress. Now, there's some dose-response factors as well. So it seems like the more you practice meditation, the better they will become, or the more effective they will be. The stress reduction approach is easy for many people to implement at home, and they can be used even free. You do not actually need to work with a practitioner, but this is recommended you seek professional guidance first, and there's generally no side effect, and they're quite present and effective. If you just want to get a taste of it, in our hospital we have these self-hypnosis free podcasts, and you can go to our website and look for integrative medicine and video, and we had uploaded some video that you can actually listen, video and audio you can listen to on self-hypnosis, and they are free and have benefited many of our patients, family member, and staff as well. And for patients, this is useful to reduce stress before treatment in the ICU, and also to have the patient sleep. The next one is this yoga. I'm talking about the more gentle type of yoga. This is a type of meditation. There are two types of yoga, gentle and vigorous, and people who practice yoga probably know what I mean, even though this is not necessarily a boundary between the two. The more gentle form of yoga usually is calming, soothing, and peaceful. This is more of a form of guided relaxation, the gentle joint work. You can stretch your tendon and muscle, and it's very soothing and relaxing. And this is a form of yoga breathing called pranayama, and this is something we had induced a study on. Just seems like if you use those exercises for even 5 minutes, you can have some beneficial effects. And again, yoga have a meditation component in there as well. The next one is this music therapy. This is some picture of a music therapy we use in our hospitals. It's probably one of the most popular inpatient integrative medicine modality we provide, and we actually give music therapy to patients during BMT, during transplant, and the practitioner, the music therapist, will gang it up and go in to have session with the patients. And among the music therapy accomplishments include they can provide gentle stimulation patient, to help them with the medications. Sometimes it can lower the blood pressure or other side effects so that the patient can receive additional medications. It can relax the patient during difficult tests and treatment, and it can also manage agitation and also the mood disturbance. The good thing about music therapy is sometimes we don't just do music therapy on the patient himself or herself. The family member are often involved, and this provides a family a way to get involved with the patients and to show them they are caring for the patient, and this is actually by itself very therapeutic. And music therapy is soothing, as we all know. And if you know how to read Chinese character, actually in Chinese, the character for music is the same character for happiness. So this association has been known for a long time. So next one is this acupuncture treatment. Acupuncture is a treatment method invented in Asia thousands of years ago. In traditional Chinese medicine, it is believed that the body is regulated by life force called qi. The qi flows around in the meridian, and if the qi gets stuck at a certain point, it will cause disease, cause pain. And the goal of acupuncture is to needle that point to relieve the obstruction of qi so that the patient can have a symptom relief. Now, of course, all these are based on traditional theory. This is not science. Now, a lot of people are concerned about acupuncture because they think acupuncture is painful, and they think acupuncture needles are dirty and can transmit disease. In fact, they're not. First of all, acupuncture needles are usually very thin. If people who went through bone marrow transplant would have needles, poking in the body all the time, thick needles, draw blood, insert bone marrow or not. Those needles, hypodermic needles, are usually like 18 gauge to 22 gauge thick. And acupuncture needles is 36, 38, and some of them even 40 gauge thin. And you can actually put 4 or 5 of acupuncture needle into lumen, the hole of a standard hypodermic needle. That's how thin they are. And most people do not experience any pain. In the old day, people tend to reuse acupuncture needle, but nowadays most acupuncture needle are single use, are disposable, so there is no risk of transmitting any disease. However, acupuncture is not magic, even though sometimes acupuncture do perform very well. Some of the theory, as I mentioned, are not necessarily based on science. So there are scientific studies looking into how acupuncture may work. And we found out that from the mechanism of action basis, acupuncture works right through the modulating of the nerve system. Because we know after inserting acupuncture needle at a certain point of the body, it can actually increase the beta endorphin in the brain. Beta endorphin you can imagine as an internal morphine in your brain to relieve pain. There are also studies that we conducted using functional MRI to look in the activity of the brain before and after acupuncture. And the particular study we did is looking into the benefit of acupuncture for xerostomia, for dry mouth. We asked a healthy volunteer, to think about something sour, then we scan the brain. A certain part of the brain lit up, activated. And then we give lemon juice to this volunteer. And then the same area also lit up, also being activated. And then we used acupuncture on a point over here called LI2. LI2 is large intestine 2, the channel going through the arm into the jaw area, the salivary gland. And this patient also have same area of the brain lit up as if they've been imagine something sour or using lemon. And also they have increase in saliva production as compared to another group who had different point activated. So this suggests that there is something to do with the nerve system. So this strong acupuncture database. Acupuncture is probably one of the most studied complementary therapy modality. And right now we know that acupuncture is effective in reducing pain, any kind of pain. It is effective for nauseous and vomiting. This has been shown that for nauseous and vomiting after chemotherapy. There are also evidence supporting the use of acupuncture for hot flashes, dry mouth, GI motility, and insomnia. And there are not necessarily scientific clinical trial, but more from practitioners' experience and some anecdotal evidence suggesting acupuncture is good for neuropathy, peripheral neuropathy. So we have an ongoing study on that as well. Some of you may have dry eye, and some practitioner acupuncturists have successfully used acupuncture to relieve dry eye for bone marrow transplant patients due to the side effect of the immunosuppressant drugs. And perhaps more study can show us whether indeed acupuncture is beneficial or not. Existing evidence only show that acupuncture only have a moderate benefit for anxiety, fatigue, or depression. Perhaps because of the study design, because some of those studies use a placebo group, which is questionable whether they can test the effect of acupuncture. If a bigger trial, better design, perhaps would show different results. But I can tell you that acupuncture is safe in trained hands. Most of acupuncture in the United States are now licensed. We also have education courses for acupuncturists who want to learn more about how to treat cancer survivors. And from the study in Germany and also in Asia, they find out that the adverse effect of acupuncture is only 0.5%, very, very low. So they are very safe. Now, if you never try acupuncture before, you can get a taste of it by using acupressure. Acupressure is that just to use finger pressure instead of a needle, and you can actually do it on yourself. One of the points is that it's a point between your eyebrow. Some people call this the third eye, as is in Ayurvedic medicine. And this point is actually very soothing. Again, this is cross-culture. People discovered that benefit. And there are a small-scale study that nurses, if they put a magnet at this point on pediatric patient, can calm the young kid when they go through treatment, cancer treatment. And if you just gently stroke this point, it has a profound calming effect. You can do this on yourself, or you can do this on people you're caring for. And another point is the point over here, below the wrist, around 2 inches below the wrist, between the two tendons, is a point called PC6, inner gate. This point is effective for nauseous and vomiting, and there's a lot of clinical study on that point as well. You probably will find a product called C-band you can buy in the pharmacy to use to relieve motion sickness, nauseous and motion sickness. That is actually an acupressure device with button pressing on that point. But if you know how to use it, you don't need to buy that band. The way to do this is that you use a thumb, or you can use a thumb to massage a point between the tendon for like a minute or two until you feel a bit numbness and tingling sensation, and after that you can do it outside. And often you will find some relief for nauseous and vomiting. Either it's chemotherapy, and there's study on nauseous and vomiting related to pregnancy, also beneficial without medication. For motion sickness, and some people don't look at it for benefit for hiccup. So if next time a hiccup, you can try that point too. And that point over here is the point between the thumb and also index finger. This is called LI4. This is very effective to relieve pain, especially pain of headache and toothache. The same method, you can use the thumb and massage this point until you feel a bit like numbness and tingling sensation. And of course, this you can do yourself, and you will go to see an acupuncturist. These are common points they will use, but they will just put a needle in there. So I want to move on to diet and nutrition. The major cancer organization estimate that a quarter of all the cancer cases worldwide are related to sedentary lifestyle and obesity. And we all know being obese, eating wrong food, wrong diet is related to increased cancer risk. And all major cancer center or organization recommend physical activities and also healthy diet, a cancer diagnosis, and for survival. And there's survival advantage, healthy diet, especially for through puberty. Young kids, if they eat healthy diet, they tend to fare better. When they grow old, they have less risk of getting cancer. So the next one is fitness or physical activities. All exercise is good, but of course it's under certain professional guidance. In our center, we offer many types of fitness exercise, including yoga. This is appropriate for patients of all levels, and we don't just offer those to patients, but anyone like the family members, staff can also come in and they can work out together. And exercise is also a major focus of our research. So in terms of integrative therapy by the time frame, when you should use integrative therapy for what purpose? We recommend it for before operation or treatment, or throughout treatment. You can use this modality to decrease stress, anxiety, and agitation. For using meditation, self-hypnosis, and massage therapy would be good for this purpose. Indeed, after operation and after treatment, chemotherapy, for example, you can use integrative medicine modality to control pain, reduce stress, and reduce nausea and vomiting, and something like acupuncture and mind-body therapy will be very effective. Acupuncture and massage therapy is also effective to relieve constipation and enhance GI motility as well. So during recovery, you can use these treatments to restore function. You can use exercise and nutrition, dietary supplement counseling is important so that you're eating the right food to help you recover. And sometimes if you have problem with range of motion because you have been kneeling in bed too long, or sometimes because the medication itself affect your joint or affect your salivation, in that case, acupuncture is effective. It's also effective to control pain in this situation as well. And thereafter, and for the rest of life, you can, we emphasize you should eat well. And if you want to use complementary therapy to relieve symptoms, it is certainly beneficial, and you can also use exercise to maintain your strength and fitness. So just one slide on quackery. Quackery is not new. Okay, cancer quackery, according to one study, this is a $14 billion business in the United States alone. And I want to reiterate that this is no viable alternative to mainstream cancer treatment. We definitely do not recommend people to use alternative therapy and delay, the mainstream treatment. Sometimes it can be dangerous. But many agents and regimens are promoted to cancer patients and survivors instead of mainstream care. Most unproved and disproven methods are biological invasive, and they are costly, and most of the time they're useless and can be potentially harmful. So bogus treatment actually you can trace back to human history, and this is the picture from Jan Steen. It's depicting in the 17th century of a charlatan or the quacksalver. Those are actually stick oil salesmen. Quack is just to shout. They would sit in the middle of a town square and then use stands, a bell, to attract people to come in to get these medicine or salve that are in fact not effective. And this happens today too, except instead of standing in the middle of a town square, you find all this on the internet. So for education and information, we want to make sure our patient getting the right information. We have this website called BioHerbs website. This is free, and we have monograph talk about herbs, botanicals, dietary supplements, and some of those unproven cures. Currently, we have over 270 entries on dietary supplement bogus method, and the website is in the top. You can go to MSKCC and search for BioHerbs, or you can search aboutherbs.com. And this website started in 2002. It was named as the top 5 website for all medicine by Scientific American in 2003, just 1 year after we launched. In 2008, the New York Times scientific writers also named us as one of the 9 most useful health resources. Currently, we have more than 2 million hits a year, and many major centers and governments also link to our site. If you ever visit our site, which I encourage you to, we provide information on the clinical summary, on the constituents, on the herbal product, if there are known constituents, and also if there's this known mechanism of action based on scientific study, we will list it as well. And we give you a warning, adverse effect, and most important, on the drug interactions. If you have an iPad or iPhone, you can also download free apps on this website so that you can access it offline. People who want to find out more information on complementary therapy, I would recommend 2 books. Both books are written by Dr. Cassidy, the chief of our service. The first one is a complete guide to complementary therapy in cancer care. The second one is Survivorship, living well during and after cancer, and I have some brochure in the front desk, and if you want to find out more, please do take a copy. And these are the people I'm proud to work with, and these are all the staff at the Integrative Medicine Service. Thank you.
Thank you, Dr. Young, for this most informative presentation. We're going to take some questions and answers now. Laura will have the microphone, which you'll pass on to anyone who has a question for Dr. Young. Thank you.
Yes, I'd like to know if acupuncture would benefit people suffering from neuropathy.
Right. So far, there is no large-scale using acupuncture neuropathy yet. We are actually conducting one right now, is still on the planning stage. There are some anecdotal evidence, and there's some limited smaller scale preliminary studies suggesting acupuncture is effective for peripheral neuropathy. Now in Asia, in China, Japan, Korea, those countries, people would not think twice using acupuncture for peripheral neuropathy because they know they're beneficial. From our own experience, from our own practitioners' experience, they find out that acupuncture probably would offer some benefit, but it needs to be treated early on when you first start getting these symptoms of neuropathy. Usually after the second, third, or fourth cycle, you start feeling numbness and tingling in your fingers. And we find out that using electric stimulation, or e-stim, on the local point around those areas seems to be beneficial. Acupuncture will be less effective if you wait a long time. For example, 5 years later you still have neuropathy, you got acupuncturist, that would be much more difficult to treat. So in terms of scientific evidence, there's some preliminary evidence, but we would like to have a large scale, like phase 3 trial, before we recommend it to all the patients. But as I mentioned, acupuncture is generally harmless. If you something that you want to try, is definitely you can consider that.
Are all of this, is this all available at the cancer center or the hospital, or, for the patients? Or, I mean, when I had my transplant 12 years ago, so the only thing that I did in the hospital was Reiki. Someone came around and did that for me, and I really wanted a massage, but just all this was not available. And so it was after that I left the hospital that I did get some acupuncture, and it was almost like I couldn't get a massage yet. I had to kind of clear it with my doctor, to make sure that it was okay to do that to my body. So I'm very happy to hear this is all happening, but I'm wondering if is it in the facility where the patients are? Do you have the staff on site? Do people come from outside?
Well, we do outpatient as well, and in our center, at least, you don't need to be a stone-carrying patient in order to benefit from our service. Anyone can come to receive our service. I understand sometimes some physician may advise you against using some of this modality because the concern is that sometimes if massage therapy, for example, do not understand or have no experience working with cancer patient, it can do some harm. For example, some cancer patient, they may have pods installed underneath the skin, and if you're not well trained, they can cause problem. But all the therapists, either the acupuncture, massage therapists, Mindbody therapists in our hospital, they're all well trained. And increasingly, the more and more hospitals are having organizing this integrated medicine service because of the demand of a patient. And we are one of the early one. We started around 15 years ago, and many other hospitals are using us as a model to build their own integrated medicine service. And of course, it depends on which hospital you go to. It also depends on the resource they have. And some hospital may have a full department like we do. But some hospital, when they talk about they have integrated medicine service, maybe just a part-time acupuncturist and maybe a part-time massage therapist. But the most important thing is that you should make sure you work with therapists that are well trained. And we do provide training program for therapists who want to learn more about how to treat cancer patients.
One more question. The acupressure, is there any kind of like a chart or anywhere I can find like a diagram that has all of that?
You go online, sometimes you do, but again, I always caution people about getting information online. A lot of those are misinformation as well. In our hospital, we do have a limited points, as I mentioned, a few of them, to teach cancer patients and sometimes nurses and healthcare providers, caregivers, and how to do this on the patients. You can also consult with well-trained acupuncturists. Sometimes after treatment, they may teach you or they can show you how to use those points so that you can have a treatment on yourself when you're home.
Thank you.
Thank you, Karen.